Welcome back to the new norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Dental and Catapult Education. Let's go back to February, midwinter meeting in Chicago. Aisles are full, classrooms are full. Dentistry is just buzzing as normal. Who's talking teledentistry back then? It's just 3 months ago. And this is not about teledentistry, by the way, this program. But who was talking teledentistry? Nobody. I didn't even know what teledentistry really was in February. Crash course now. What was being shown at Midwinter? So there was a company showing a technology, and it was showing teledentistry, but in a total different form. And as doctors and hygienists would walk by the demo, some would buy, and some would move on thinking this is really too much of the future. Well, what really we're gonna see in this interview, and there'll be 2 episodes of these interviews with the company of Smart Mirror, is this was teledentistry really on steroids and far more than teledentistry. So what has happened in this pandemic business-wise is that many businesses will probably fail. They're just not gonna be able to regroup, and I'm not talking dentistry, it's just business, some businesses in general. Others, and new technologies and other businesses will flourish in this pandemic time and post-pandemic time, openly because they'll adapt, they'll have new products, and these new products will bring us forward. And that's what we're gonna be talking about today, a new product that is a game changer in dentistry. 4 years ago, I think it was 4 years ago, I got a call from an Israeli, I would call high-tech technology expert. And he called me on the phone and said he was coming to the United States. And could we meet in Chicago? I was more than happy to meet him in Chicago. And as we got into his presentation that night over dinner a few weeks later, I was in awe. And I asked him, why would you develop this? And he goes, I'm married to a dentist. And I go, that's so cool. So ultimately, we've all become unbelievably close friends. Well, with that said, he's walking me through this vision, and I go, how do I know you can do this? So he says, pull out a USB drive. So I pull out a USB drive, thinking he's going to now let me download his presentation. But no. Dan says in this nice casual way, what do you think of the USB drive? And I go, it's unbelievable. For storage, I grew up with floppy disks, CD-ROMs, and this is a game changer. He looked at me and he goes, my team developed it in Israel. And at that moment, I paid particularly close attention to this vision because I knew he could walk the walk and not just talk, but walk the walk. And I'm gonna tell you as I introduce both Dan and Josh, I will tell you this is gonna change dentistry. And over the next 2 episodes, you are gonna see how this is gonna change dentistry, both in the operatory and how we're gonna be able to communicate with colleagues, specialists, labs, and patients, and far more. How it's gonna change workflow. That's what Smart Mirror will do. I saw it 4 years ago, and now with the pandemic, it's even gonna come full front. It's gonna just come right to us. So with that said, I'm gonna introduce the owner, and I'll call Chief Brilliant One, Dan Harkabi. And I'm also gonna introduce a doctor, Josh Wachpress, who is an orthodontist who's been involved from day one in this, and he practices in Israel. So he's part of the pandemic and what we're trying to do. And I thought bringing an orthodontist on who's been using this now for well over a year or more, it'd be great to get their insight. So first off, welcome from Israel, our first global new norm, Dan and Josh. It's great to have you on the show, you two.
Thank you.
Great
Dan,
to be here.
Thank you, Josh and Dan. Dan, let's start with you. Dan, tell me your vision of Smart Mirror. And I'm going to keep this crisp so we won't be verbose. Tell me your vision of Smart Mirror.
The vision, just like with the USB drives, the vision was to replace all floppies with something that everyone can carry all their data in their pocket. So Lou, the vision is that we've taken the dental mirror that every dentist, every hygienist is using on every operation, and to let them use a smart mirror, something just in the shape of a mirror. And it's still a mirror. You can work with it as a mirror, but it floods the mouth with light. And on the other hand, it has to be smart. So there is a medical grade camera inside that can show you things that you could have never seen before. And there are LEDs that flood the mouth with light. And you know what? If it's smart, there has to be a microphone. So with Smart Mirror, you can talk to the mirror and it transcribes whatever you say in order to speed up and to allow you to summarize the treatment and pull it into your office management system.
So Dan, let's kind of review a couple things just to start this discussion off. And then I'm going to ask Josh a question, then we're going to get into more vision. So we've got a mirror here with almost beautiful natural light LEDs. You've got voice transcription in this mirror through the handle. And then you've got this video microchip camera right in the middle of the mirror that is basically live streaming. Is that correct?
That's correct. And that was our version 1. And we came in order to make it very small. So we will not compromise on the values that the dental mirror has. And right now we're coming out with our generation 2 that brings other important attributes. One, that it is also, like every mirror, you can autoclave it.
Right.
Because we realized early on that dentists need a mirror that they can autoclave. So in a way, I don't know if you can see, we've separated. On my right hand is our first generation. This is our second generation. So as you can see with second generation, you can remove the smart mirror electronics and separate it from the smart mirror head. This way you can autoclave the smart mirror head, and you can have few smart mirror heads with just one piece of smart mirror electronics.
That is a great advancement from version 1 to version 2. I love that. So let me just mix this up a little, Josh. So let me ask you this. The first time I saw this, the first thing I could do is think, okay, it's like an intraoral camera. And we all know now, Josh, it's absolutely not an intraoral camera. So in your practice as an orthodontist currently, and really let's call it pre-pandemic, tell me the 2 or 3 things that were the wows in your practice with this.
So Lou, I agree that we should separate it into pre-COVID and current, or during the COVID. So pre-COVID, I was using Smart Mirror as a very powerful patient education tool and as a marketing device. When I came in to greet a new patient, obviously they had been prepped by our new patient coordinator. They had their pan and their photos up. But when I took out Smart Mirror, and the patient sees their face, their mouth on their chair-side iPad, it takes them a second to figure out where the camera is. And then there's like this magic moment where things light up. And also mom's usually sitting right next to them. And while I'm doing my examination and transcribing the exam, they watch in awe. It's incredible, because I'm not trying to sell them anything. I'm just showing them what I see while I see it. So it's not a sales pitch as much as this is what your child has. And I think this is how orthodontists can help. So I have probably 2 to 3 minutes that they buy Dr. Josh. When I sell myself as their provider, they trust me, and then it's pretty much smooth sailing from there.
So Josh,
And
let
our
me just
closure
say-
rates
yeah,
from the
go
first
ahead.
exam.
Go ahead, closure rates. Go ahead.
I was going to say our closure rates from during that first exam, that first between 3 to 5 minutes where I'm with the patient and I hand them back to my patient coordinator, it's gone up about 15% just in the past couple of months. And I believe just because of Smart Mirror and my ability to engage the patient and make them appreciate the importance of the orthodontic treatment.
So because I'm still pre-pandemic, in our office, when we got the version 1, Josh, people had never seen their teeth close up like this, ever. And the fact that it's live streaming and they're holding this iPad and a hygienist can walk them through their mouth where they're not brushing right. Or, in fact, for you, Josh, if you were debonding, taking bonding off of a patient, you could actually go right up close with that mirror and look to see, did I get off all that composite off of the canine? Am I missing any of this in pre-pandemic world?
Okay. So absolutely. So I think there's the clinical aspect where I can see up to 10, 12x magnification, which I can never get with my loupes. Even to see residual adhesive while I'm placing brackets, which I can never see before. And we've all done that thing with our hands, little Johnny's teeth, he has a class 2 malocclusion. I don't do that anymore. I have another iPad, give it to mom sitting in the chair.
Right.
And I show her, this is where Johnny's not brushing. Our hygienists love it because they don't have to talk as much. They just show, say, look here, this is where you have to brush better.
So Josh, and I'm going to get back to Dan, but Josh, clinician to clinician now. I'm in the pandemic world. I worked last week, saw 6 hours of patients, busy day, exhausting. And openly, with a face mask and your KN or your N95s, and you're wearing loupes with these face masks, first off, the light doesn't work. The light does not work through it right now unless you've got some kind of customized or larger face mask. How are you using Smart Mirror now we're in the pandemic world? How is Smart Mirror with the visibility helping you? If you don't mind me asking.
Okay. So Lou, yesterday was our first clinic day back with my staff. I was so happy to have them back.
Yeah.
I miss my staff, but I miss my patients, unbelievably so. We ran our office at about 20% capacity to try and figure out how to work. We had sat down, we had gone over it, rehearsed it, but nothing prepares you for bringing the patients in. They're all wrapped up. We're wrapped up in our Glad bag gowns, and it's really uncomfortable. I gotta tell you, to work that way. So without my loupes, I did a number of debondings, a number of arch wire adjustments. And what I did yesterday is I had Smart Mirror up in my chair. The iPad is on the stand, probably about 2 to 3 feet in front of my face. And I'm sitting up, my shield is on, and I'm just looking with the mirror, and the image is projected on the iPad. It was actually pretty comfortable. I'd say for the first hour or two, I was really missing my loupes.
Yeah.
And by hour 3 or 4, I was like, what the heck? It was great.
So it really became a necessary tool or a necessary technology without your loupes, because we're all loop dependent. Agreed?
Right. At my advanced age, I need the magnification.
Okay, me too. So let me go back to Dan now. And Dan, so I see Smart Mirror ubiquitous in dentistry, whether it's hygiene, ortho, general dentistry, it's everywhere going forth. And you talked about it being in every operatory. Let's really now dive into what I started off our conversation with this morning, teledentistry. I have my thoughts. How do you envision Smart Mirror and teledentistry? Because I think it's going to be part of the new norm, which could be for years to come. Talk to me about teledentistry in your views.
So when this whole thing started, I realized that I need to make major changes and go faster in our development, creating
Right.
a standalone, what we called smart mirror teledentistry. Because we thought that you'll have cases that you treat your patient, and then when you send them home, you don't want to call them back for the next week or few days just to do an inspection.
Right.
So with generation 2, you'll be able to give to your patient a smart mirror teledentistry which connects directly to his iPhone or Android phone, so he can go back home, self-inspect himself in front of the mirror, have his mouth lit up, and because the mirror is not just a mirror, it has even accelerometer, which means always the picture is up and down is down, and right is right and left is
Right.
left.
Right.
So remotely, the dentist can remotely navigate the mirror at the mouth of the patient without the patient need to come to visit your office. So if you are doing an implant or anything like that that you need a follow-up, you can save unnecessary visits. The other issue is also in the office. I've seen many cases that an hygienist, for instance, she's done all her work, she's inspecting, and now she needs to call the dentist to come in and to do his oral inspection. That doesn't fly. Now to change all your gloves, all your masks, all of that, it takes tons of time. So what I envision is that the hygienist takes a thorough visit of the mouth. If she sees something, then she also captured the video. And then at the end of the day, the dentist is coming, sitting with the hygienist, and they can go through the video and decide whether to invite the patient in 3 months or to call him for next week. Furthermore, they can crop that short video and send it easily by email to the patient to say,
Right.
hey, I've looked in, I see that everything is okay. Wonderful to see you. I hope that 3 months from now everything will be better, and so on. So teledentistry has so many aspects,
Right. So
and that's the way I see it.
right. So Dan, let me just kind of I totally agree. So this is where I really see smart mirror just gaining more and more momentum beyond just the office. As Dan launches his next version, and there'll be like single smart mirrors, Dan, basically, I would say if I just placed an implant in a patient or I did surgery or something more extensive, in the past, pre-pandemic, I'd bring a patient back for a post-op. Now to bring a patient back post-op, I've got to redo their PPE, redo the COVID questionnaire, redo everything. And openly, for probably a 1 to 2 minute post-op, I just see it as a costly procedure for the patient. In your world, I could see having 3 or 4 of these smart mirrors after surgeries, giving them like a pre-postage, box, so it'll just be shipped back to me after 2 or 3 weeks. So I can monitor them at home, probably bill teledentistry post-ops, and save the patient from coming in. I think that's brilliant. I do think, Dan, go ahead.
And Lou, especially, the call for call of the hour is treating elderly. And those of age are of a much higher risk. This is a life-threatening. You may have saved this patient coming in, and maybe on his way in, he could have been getting unnecessary exposure. So that's the way I see that. And of course, Josh, correct me, that can be also your situation when you're having a follow-up on positioning brackets.
Absolutely. In terms of teledentistry, I think, Louis, want to break it down and get into the pre-COVID and the today's world. Already before the pandemic, I was using intra-office teledentistry. I have an open bay setup. I have a couple of hygienists that are changing wires or doing whatever they're doing. If I'm in the middle of a long procedure and the hygienist 2 chairs over pops off a bracket, I got to stop what I'm doing, deglove, go tell her, let's
Right.
rebond it or just cut the wire. And now what they do now is they just bring over the iPad, which is connected to that hygienist system. I can see exactly what she's seeing. I don't have to stop what I'm doing.
Exactly.
And I would envision this is so powerful. It just saves me a ton of time.
So wait, Josh, I gotta
Nowadays-
stop. Wait, Josh,
Sure.
on
Yeah.
that, I envision the same thing, which gets back to Dan's thing about the recall exam. The hygienist does something. She can walk over. I can turn. I'm in my full PPE. She can be talking to me through her mask, my mask, and going, "This is what I'm seeing," and I go capture everything. I will tell a dentistry the patient at the end of the day. I'll review everything. And my recall exam is just like Dan is saying, is really, it's really, I'm there, but I'm really not there. And I'll be there when I actually communicate online with the patient. Isn't that kind of what you're also seeing?
Yeah, and I think you hit the nail on the head. We have to be productive getting back to work because I think we all took a really big hit the past couple of weeks. And every patient encounter is
Yeah.
exceedingly expensive.
Yeah.
And really have to maximize that time with the patient. So if we can save 2 minutes, 5 minutes, forget the cost of the PP, but we save those seconds, those minutes, it's invaluable at this time.
You know, I hear you with costs, but I would also say the time is my precious thing. You got to turn over the room as soon as they leave. So that 2-minute post-op in my world, or that 2-minute quick check, oh my God, it's really 15 to 30 minutes. And you're right, Josh, I don't want those 2-minute checks turning into 15 or 30 minutes. Okay, so this is what I want to do for my viewers. We're going to do episode 2 on the new norm. I'm going to bring Dan and Josh right back. So I'll see you in just a few minutes. Be safe and be smart. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.